Routine assessment of the small baby. The health of a small baby can change rapidly. Regular assessment can identify problems quickly that can lead to important changes in the care of the baby. This video will show how to assess a small baby and includes 3 scenarios that illustrate the cycle of evaluation, decision-making, and taking action. Assess the baby morning, afternoon, and night. Here are the 3 steps. First, talk to the mother. Ask her if she has noticed anything about her baby that concerns her. She is the key caretaker and a partner in the care of her baby. Second, examine the baby. Wash your hands, then do a basic exam. As you check the baby, teach the mother key observations. Does the baby look well? Observe his activity. A well baby will be alert and active when awake. Show the mother examples of danger signs. An unwell baby may be sluggish or have convulsions. How is the baby breathing? A well baby breathes comfortably at a rate between 30 and 60 breaths per minute. An unwell baby may breathe too fast, have long pauses in his breathing, or have chest indrawing, and sometimes a grunting sound. Observe the baby's color. A well baby will have pink lips and tongue. An unwell baby may have blue lips and tongue. Or jaundice, a yellow color on his palms or soles. Check the baby's abdomen. A well baby has a soft belly. If the belly is distended, the baby may have a problem. Check the baby's temperature. Show the mother how to feel the temperature of her baby's foot. If it's cold or hot, check the baby with a thermometer. Then, zero the scale, weigh the baby, and record it in the baby's chart. Third, evaluate how the baby is feeding. Find out how much milk the baby takes and how often he feeds in 24 hours. Whether by breast, cup, or feeding tube. Ask about the baby's stools. He's feeding well if the stools are yellow and frequent, 4 or more each day after the first week of life. Advise the mother that if she has any concerns about her baby, she should notify a health worker right away, day or night. Bring together the mother's observations with your own findings to discover small changes in the baby's condition quickly. Each time you check a baby, decide, is the baby well? Or is there a concern? Does he need closer attention? Or is he unwell and needs advanced care? From that decision comes action. Write your findings in the baby's record and communicate with your co-workers to keep all caregivers up to date on the baby's condition. The following scenarios illustrate a cycle of evaluating, deciding, and taking action. In the first scenario, the mother reports her 3-day-old baby is doing well. He has normal activity, color, and warmth, and breathes comfortably. The mother is expressing her milk well. The baby is starting to breastfeed and taking the recommended volume of milk per cup every 2 to 3 hours. His weight is stable. The health worker decides the baby is well. She takes action by praising the mother for caring so well for her small baby and increases the volume of his feedings. In the second scenario, the mother reports that her baby is cold. The health worker evaluates by rechecking the baby's temperature with a thermometer. His temperature is 35.9 degrees. This is a concern. She decides the baby is too cold and needs to be warmed up right away. The health worker takes action by removing the baby's wet clothes, having the mother position her baby skin to skin, and adding blankets on top. She checks the baby an hour later. The baby is now warm. In the last scenario, the baby cries normally at birth. Soon after, when he doesn't move actively, the birth attendant realizes the baby is having difficulty breathing. He has long pauses in his breathing and chest indrawing. The birth attendant decides the baby is unwell and needs advanced care.
I need some help.
She quickly gives the baby breaths and continues to ventilate him during the transfer to the hospital. Remember, assessment is a cycle of evaluation, decision, and action. The mother is the key caretaker. Teach her how to observe her baby. Evaluation includes the mother's observations, a brief exam, checking temperature and weight, and assessing how the baby is feeding.